What is an early miscarriage?
So if you lose your baby in the first 3 months of pregnancy, it is called an early miscarriage. Most women experience vaginal bleeding, but occasionally there may be no symptoms. If this is the case, the miscarriage may be diagnosed by the ultrasound.
Why do early miscarriage happen?
In most cases, it is not possible to give the reason of an early miscarriage. But most common cause is thought to be a problem with the genetic material in the baby, which we call the chromosomes. If a baby does not have the correct number of chromosomes, it will not develop properly and it may be miscarried.
What are my chances of having miscarriage?
Sadly, early miscarriages are very common in the first 3 months, and 1 in 5 women will have a miscarriage if no apparent reason following a positive pregnancy test. The risk of miscarriage is increased with increasing age, like in 40 years of age, the risk of miscarriage is 1 in 2, 50%. Or if the woman is having a medical problem like diabetes, lifestyle like smoking or having a heavy drinking.
So what should I do if I have bleeding and pain in the first 3 months?
Vaginal bleeding or pain in the early stages of pregnancy are not always like there is a problem or there is a miscarriage, but it can be a sign of miscarriage, so you should seek the early medical advice.
How is it an early miscarriage diagnosed?
Early miscarriage is usually diagnosed by the ultrasound scan. You may be advised to have a scan either through the vagina or through the abdomen. But the transvaginal scan is going to give the more clear image. Neither scan increases your chance of having a miscarriage.
So what are my choices if a miscarriage is confirmed?
If the ultrasound is showing that you have a miscarriage and nothing remains in your womb, then no need to do any further treatment. But if the miscarriage is confirmed and you have the whole pregnancy inside or some of the pregnancy inside, then you have an option. Then the doctor will talk about the options, either to wait, either take the medical treatment or the operation.
Am I at higher risk of miscarriage next time?
You are not at higher risk of another miscarriage if you don't had 1 or 2 early miscarriages. Most miscarriages occur as a one-off event and there is a good chance of having a successful pregnancy in the future. A very small number of women have a condition that makes them more likely to be miscarried. In this case, medications may help.
So is there anything else that I should know, Doctor?
Like anyone else planning to have a baby, you should take 400 micrograms of folic acid, eat a good and balanced diet, stop smoking, not drink alcohol, as this may increase the risk of miscarriage.
Thank you so much.
Thank you.